Hello everyone, today I'll be talking about anatomy of thyroid gland in brief. Thyroid gland is an endocrine gland situated in the lower part of the front and the sides of the neck. It contains a right and a left lobe which are joined by the isthmus. The thyroid gland extends from the C5 to the C7 and the T1 vertebra. Each lobe extends from the middle of the thyroid cartilage to the fourth or the fifth tracheal ring. And the isthmus extends from the second to the fourth tracheal ring. Talking about the dimensions of thyroid gland, each lobe is around 5 by 2.5 by 2.5 centimeters and isthmus is around 1.2 by 1.2 centimeters and the thyroid gland weighs around 25 grams but it can be variable. Thyroid consists of two capsules, the true capsule and the false capsule, as you can see in the corresponding diagram. Talking about the lobes of the thyroid gland. Each lobe of thyroid gland has an apex, a base, three surfaces which include the lateral, the medial and the posterolateral surface, and has two borders, the anterior and the posterior border. Just a few points on relations of the thyroid gland. The apex of the lobe of thyroid gland is related to the superior thyroid artery and the external laryngeal nerve. The base is related to the inferior thyroid artery and the recurrent laryngeal nerve. The lateral surface is related to the sternohyoid, the superior belly of the omohyoid muscle, the sternothyroid, and the anterior border of the sternocleidomastoid muscle. The medial surface is related to the trachea, esophagus, the inferior constrictor, and the cricothyroid. And also to the external laryngeal and the recurrent laryngeal nerve. The posterolateral surface is related to the carotid sheath, the anterior border is related to the anterior branch of the superior thyroid artery and the posterior border is related to the inferior thyroid artery, and the parathyroid gland. Talking about the isthmus, it connects the two lobes of the thyroid gland, and it has two surfaces which include the anterior and the posterior surface, and has two borders which include the superior and the inferior border. Talking about the blood supply of thyroid gland. The arterial supply is from the following arteries: the superior thyroid artery, which is the first anterior branch of the external carotid artery. Next, what we have is the inferior thyroid artery, which is a branch of the thyrocervical trunk which arises from the subclavian artery. Also, there can be accessory thyroid arteries. These accessory thyroid arteries can arise from tracheal and esophageal arteries and supply the thyroid. Venous drainage occurs through the superior, the middle, and the inferior thyroid veins. Talking about the lymphatic drainage of thyroid, the pretracheal, the prelaryngeal, and the paratracheal group of lymph nodes drain lymphatic from the thyroid gland and further drain into the deep cervical nodes. Talking about the nerve supply of the thyroid gland, it occurs from the cervical ganglion, mainly from the middle cervical ganglion and partly from the superior and inferior cervical ganglion. So this was all about anatomy of thyroid gland in brief. Here is the overview of what I have discussed. If you think this video was helpful, do like this video, share this video, and subscribe to my channel. Thank you.